The topic for today's discussion is gluteal region. So gluteal region is the prominent area that extends from the level of iliac crest superiorly till the gluteal folds inferiorly. In between is the intergluteal cleft. The cutaneous nerve supply of the gluteal region is such that we divide the gluteal area into four quadrants: the upper outer quadrant, upper inner quadrant, the lower outer quadrant, and the lower inner quadrant. The upper outer quadrant is supplied by the lateral branch of 12th thoracic nerve and the lateral branches of the iliohypogastric nerve, that is T12 and L1. The upper inner quadrant is supplied by the posterior rami of upper three lumbar nerves and upper three sacral nerves, that is L1, L2, L3, S1, S2, S3. The lower inner quadrant is supplied by the posterior cutaneous nerve of thigh and its branches, and the lower outer quadrant is supplied by branches of the lateral cutaneous nerve of thigh. So we divide the gluteal region to four quadrants, and each quadrant is supplied by different nerves, cutaneous nerves. Now, the ligaments of the pelvic girdle, the most important ones are the sacrotuberous ligaments and the sacrospinous ligaments. The sacrotuberous ligament is between the sacrum and the ischial tuberosity here, and the sacrospinous ligaments are between the sacrum and the ischial spine here. The foramina of gluteal region are the greater and lesser sciatic foramina, and there are various structures that pass through these foramina. The greater sciatic foramina allows the passage of piriformis, a muscle, very important. Then the sciatic nerve, posterior cutaneous nerve of thigh, superior and inferior gluteal nerves, the nerves to obturator internus and quadratus femoris, pudendal nerve, superior and inferior gluteal arteries and veins, and the internal pudendal artery and vein. Now, amongst these are a few structures that pass through the greater sciatic foramen and come out through the lesser sciatic foramen. These are the tendon of obturator internus, nerve to obturator internus, pudendal nerve, and internal pudendal artery and vein. The muscles of gluteal region are the gluteus maximus, medius, and minimus, which are attached on the gluteal surface of the hip bone or ilium. Then we have the piriformis. The tensor fasciae lata is one of the gluteal muscles. The quadratus femoris, obturator internus, obturator externus, superior gemellus, inferior gemellus. These are the muscles of the gluteal region. We are going to do these one by one. Now, the attachment of gluteus maximus is from the posterior gluteal line till the area behind it. In this picture, the gluteus maximus has been removed, and we can see the gluteus medius and gluteus minimus. The gluteus medius is attached from between the anterior and posterior gluteal lines, and it is inserted on the greater trochanter of femur. And the gluteus minimus is attached below the inferior gluteal line, and it is also attached to the greater trochanter of the femur along with the gluteus medius, and the gluteus maximus is inserted into the gluteal tuberosity and partly into the iliotibial tract here. So these are the three gluteus. Here we can again see the gluteus medius muscle, the minimus muscle. Next we can see the piriformis muscle. The piriformis is attached to the pelvic surface of the sacrum, and it is inserted on the medial surface of the gluteal greater trochanter. The gemellus superior, gemellus inferior, and the obturator internus in between. These three are also inserted on the medial surface of the greater trochanter of femur. Then is the quadratus femoris muscle. It is originated from the upper part of ischial tuberosity, and it is inserted on the quadrate tubercle on the femur. Then we have obturator internus muscle. Obturator internus muscle is attached on the inner side of the obturator membrane and the bone that is forming the obturator foramen, and it is inserted along with the two gemelli to the medial surface of the greater trochanter of femur. Then we have In this picture, we can see again the gluteus maximus, the tensor fascial artery. Yes, it is attached on the anterior 5 centimeters of the iliac crest, starting from anterior superior iliac spine, and it is inserted on the anterolateral tubercle of tibia here. Then these are the muscles of the gluteal region. We have three gluteal bursa. One is the trochanteric bursa, that is between the gluteus maximus and the greater trochanter of femur. The second is ischial bursa. This is between gluteus maximus and the ischial tuberosity. And the last one is gluteofemoral bursa. This separates the iliotibial tract from the proximal attachment of vastus lateralis. In this picture again, we can see the three bursa, the ischial bursa, the trochanteric bursa, and the gluteofemoral bursa, the three bursa, the various muscles of the gluteal region again, the gluteus maximus, medius, minimus, tensor fascial lata, piriformis, superior gemelli, inferior gemelli, obturator internus, quadratus femoris. These are the muscles of gluteal region. Then are the vessels of the gluteal region. We have two main arteries, the superior gluteal artery and the inferior gluteal artery. In this picture, we can very clearly see the branches of the superior and inferior gluteal arteries. This muscle is the demarcating muscle. This is the piriformis that is passing through the greater sciatic foramen. The superior gluteal artery comes out of the greater sciatic foramen, enters the gluteal region above the piriformis. Initially, it gives a superficial branch, this one, and a deep branch, this one. The deep superficial branch supplies gluteus maximus, as we can see. This is the cut section of gluteus maximus, and the superficial branch is entering the gluteus maximus muscle. The deep branch further subdivides into a superior branch and an inferior branch. The superior branch anastomoses with the ascending branch of lateral circumflex femoral artery. And the inferior branch of the inferior division of the deep branch takes part in formation of the trochanteric anastomosis here. Next is the inferior gluteal artery. It enters the gluteal region through the greater sciatic foramen just below the piriformis muscle. This is accompanied by the inferior gluteal nerve. It supplies it gives an articular branch to the hip joint, cutaneous branch to the gluteal region, then muscular branches to muscles of the gluteal region. Then it also gives anastomotic branches to the two anastomosis taking place here, the trochanteric and the cruciate anastomosis. In this picture, we can again see this piriformis, above which is the superior gluteal artery, below is the inferior gluteal artery, and both of these are taking part in formation of the trochanteric anastomosis, and the lower one is also taking part in formation of the cruciate anastomosis. Now, what is the trochanteric and cruciate anastomosis? The trochanteric anastomosis is taking place at the area of the greater trochanter of femur. It is formed by the superior gluteal artery, inferior gluteal artery, and the ascending branches of the lateral and medial circumflex femoral branches. And the cruciate anastomosis is between the transverse branches of the lateral and medial circumflex femoral arteries, the inferior gluteal artery, and the first perforating artery of the profunda femoris here. So this one is the cruciate anastomosis, and this is the trochanteric anastomosis. And both the superior and inferior gluteal arteries are branches of the internal iliac artery. The superior gluteal is branch of the posterior division of the internal iliac, and inferior gluteal is the branch of anterior division of the internal iliac artery. Here again we can see the trochanteric anastomosis, and this is the cruciate anastomosis. The nerves of gluteal region are mainly the branches of the sacral plexus. So what is sacral plexus? It is the plexus which is formed by the ventral rami of L4, L5, S1, S2, S3 and S4. It further gives off ventral branches and dorsal branches, which are the nerves of the gluteal region. These are the superior gluteal nerve, the inferior gluteal nerve, the nerve to piriformis, nerve to quadratus femoris, nerve to obturator internus, the posterior femoral cutaneous nerve, the perforating cutaneous nerve, and the pudendal nerve, and the greatest of them all is the sciatic nerve, which is a combination of the posterior and anterior division of the sacral plexus. In this picture, we can see this is the superior gluteal nerve, which accompanies the superior gluteal artery. This one is the inferior gluteal nerve, which accompanies the inferior gluteal artery. This thick nerve is the sciatic nerve, which is the nerve of posterior compartment of the thigh. Now, what is Trendelenberg sign? The gluteus medius and minimus muscles are supplied by the superior gluteal nerve. These two muscles of, let's say, right side are supporting the left side. If the gluteus medius and minimus of the right side are intact, during walking it supports the opposite limb. But in case of any injury to the superior gluteal nerve, it leads to paralysis of gluteus medius and minimus, which fail to uh, uplift the opposite limb, and it leads to uh, the drooping of the opposite limb, and the gait in this case will be called the lurching gait, and the sign is called the Trendelenberg sign positive. I'll repeat again. If gluteus medius and minimus of right side is paralyzed, it won't be able to support the opposite limb and it will drop. This is called positive Trendelenberg sign. The site of intramuscular injection in the gluteal region is the upper outer quadrant of the buttock, because no important vessel or nerve pass through this area. So it is safe to give intramuscular injection in the upper outer quadrant of the gluteal region. That's all for today. Thank you.